Hello, good evening. My name is Sherry Shelton. I am making this video for my Nursing 4502 Leadership and Management class. I live in Trophy Club, Texas. That's perfectly in the middle between Fort Worth and Dallas, Texas. I am married and I have two sons. One's in middle school, one's in high school. I'm getting my BSN because my current employer, Baylor All Saints Medical Center in Fort Worth, Texas, requires you to get your ADN to your BSN. You have 30 months signing a contract to get that, and if not, then you lose your job. But it's always been a goal or dream of mine for the last 4 years. I just procrastinated, and I need that push to move me forward into, pursuing my dreams and goals. Currently, I work in an endoscopy unit. I started out on every other weekend because I was a school nurse during the week, and have recently increased mine from part-time and full-time work. I chose that job because I'd been out of the hospital for approximately 16, 17 years, and I didn't want to lose my skills. I knew that I needed to get back in the hospital, and I missed the work. So the thing that I'm most excited about through this whole program is this class, the Leadership and Management, because I feel like one of the important aspects of being a leader is to be an effective communicator. I believe that miscommunication causes a lot of problems and misunderstandings. The leader role that I had before coming to the hospital, is when I worked as a school nurse for 10 years. I had to train people, 2 staff members by law, to take care of the diabetics on campus if I were gone or in an emergency situation with another student. I also was responsible for training all of the staff on how to administer an inhaler, EpiPen, do hands-only CPR, and the AED machine. I would also teach the teachers, like if they were going to go on a field trip, I would teach them about the medication, the side effects, and things to look for, and send 1 dose of medication with the teacher to administer for that child. I'm passionate about nursing and being able to help others and educate them and their family members about their condition and health preventative measures. I get really frustrated over our country's health care and the benefits or lack of benefits. When I first started working as a school nurse, I had a child that was deaf, and his insurance only paid for 1 cochlear implant when in fact he needed 2. Another instance would be a diabetic child that I took care of in elementary school. His insurance only paid for a certain amount of test strips per month. I guess they didn't take into account that he needs to test his sugar before doing 50 minutes of exercise, or check his blood sugar again if he felt symptoms. He was symptomatic of high or low, unsure because of his age and being newly diagnosed. I believe that nurses need to stay up to date on the latest trends and technology in order to offer the best care possible. So therefore, I think all nurses should be involved with their local, state, and federal laws. We need to be the ones that advocate change for our patients that will benefit individuals and our society as a whole. With people living longer, then I feel like we need to focus on educating everyone, starting at a young age, even as early as elementary school age children, just on how to eat healthy, the benefits of health, and exercise. Listing the health benefits for them, but also the risk and results for the various health conditions and disease processes if they choose not to. So I really look forward to meeting everybody, and I'm super excited about this class and all that I'll get to learn. Thanks, and have a good evening.